We know here in Alaska, 1 out of 5 women come to us for care at some point in time in their lives. That's a lot of women. That's a lot of stories. That's a lot of unique stories.
It's almost impossible to have a single story that fits every single person who walks through these doors.
Planned Parenthood is where I learned to care for myself, learned how to care for my body. When you are allowed to control your reproduction, you have control over the rest of your life.
I think it was after our second child was born, I went and got an IUD. Then you went there, yeah, to get a vasectomy.
We see everyone here at Planned Parenthood. We do a fair amount of primary care, so we see people for hypertension and diabetes, and we see both men, women, young people for all of those things.
A few months ago, I had passed a large blood clot and went to the emergency room. They had told me basically that I was okay and I should seek follow-up services. And I went to a bunch of doctor's offices, 2 of which weren't willing to even see me unless I had a payment plan. And so at this point, I've passed the blood clot and for 3 days I've been bleeding. I think by the 4th doctor's office, somebody had referred me to Planned Parenthood. At Planned Parenthood, they gave me answers within 30 minutes of being there.
So when I was 15, I was sexually assaulted and I didn't know what to do. I went to Planned Parenthood and I explained what had happened and they gave me everything I needed. They gave me accurate health information, which is something that I really needed at the time.
Alaska has some pretty high rates of a number of things.
Alaska is #1 in chlamydia.
We're also first when it comes to sexual assault and reported rapes.
The child sexual assault rate is 6 times higher than the national average.
About 90% of the women that come out of our small town on Kodiak Island have experienced sexual assault, domestic violence, molestation. I mean, just imagining 90, in the 90th percentile, having those kind of, assault and degradation, happening to women is like unheard of.
When Alaska's already facing all of these public health challenges, we can't afford to lose access to health care at Planned Parenthood.
Neither my husband or I have health insurance through our work. Before the Affordable Care Act, I think we'd gone about 12 years without health insurance, and Planned Parenthood was there for my preventative reproductive care.
I am terrified of what it will look like if the ACA is repealed.
If people aren't receiving access to contraception, if they're not receiving the IUDs, if they're not getting the STI and the HIV tests, we are going to see negative impacts within our communities.
I cannot imagine what our community would do without Planned Parenthood, because having to sit in 3 waiting rooms before you're able to seek healthcare, especially after you've been assaulted, can be daunting.
A lot of what's happening is going to directly affect people's lives, and I think it's rare to find that in like your normal day-to-day politics is just this or that and blah, blah, blah. But taking healthcare away from people is going to directly affect people's lives.
When we look at this defunding fight, the Alaska representatives will be critical votes, and women and men in Alaska will absolutely be critical, and sharing their stories about how that defunding could impact them will be certainly some of the most compelling messages in the country.
This movement, it needs people who have personal stories that are associated with Planned Parenthood. If we don't all collectively work towards a better world and for these issues in our society to go away, then they aren't going to.